Here's another good story. Doctors in Texas are opting out of Medicare at an alarming rate. A study showing hundreds of doctors in that state dropped out of Medicare in the last 2 years. Mark Siegel joins us. Dr. Mark Siegel joins us. Doctor, welcome back.
Hi, Stuart. How are you? 300
doctors drop out of Medicare in Texas in 2 years. I put it to you, that is not a flood of doctors leaving. There's 30,000 doctors in Texas? Must be.
Stuart, that's just the tip of the iceberg. 4 out of 10 have said they're considering quitting Medicare. And if you look back 2 years, the Texas Medical Society, which, by the way, did not support the health reform, did a survey, and they found that 40% of doctors were not taking new Medicare patients, 60% of primary care doctors like me. So if you were an elderly person in Texas looking for a doctor for Medicare, you couldn't find one. That's also true nationwide. A survey from MedPal showed that 28% of patients could not find a Medicare physician, a new one, in 2008. That's a big deal.
Okay, so they're being squeezed out of offering their services to Medicare patients, new Medicare patients.
Well, and you know,
now you said this is a trend that's going to occur all across the country. Is it directly the result of health care reform?
It is directly as a result of health care reform. Let me tell you why. We're already in a position where out of $1,000 I bill for Medicare, after expenses, I may make $200. We can't afford to keep our offices open. And we know that with health reform, with the cuts that are going to come to Medicare, not only am I going to be paid less and less, not only are my expenses more and more, but I know the services I'm going to order for my elderly patients are going to be turned down, making it harder and harder to practice on that dime.
You know, it sounds like really dramatic stuff here. I mean, if I'm an elderly person and I'm watching this program, I'm hearing you make some dire predictions here. I'm worried that I can't go to my doctor and get treated under Medicare. I mean, I'm not saying it's a scare, but you are scaring
I'm going to make it even worse. I want to scare you even more. I'm talking primary care. Let me tell you, surgeons have a problem too. Do you know that if you do a hip replacement under Medicare, you may make about $900? That may sound like a lot of money, but you got to book out 2 hours getting ready for the operation, an hour after the operation. My orthopedists that I refer to are saying, I'm not going to do those hip replacements anymore. Cataract operations, we've talked about on that show. So if I can't refer my patients for procedures...
So what does that mean, though? All these people are just going to be crippled and die?
It means they're going to have a problem finding a doctor. It means, talk about scam, it means that when the president said, we're going to give you all insurance, he didn't ask the question, what's the insurance going to buy you? If you don't have a doctor to go to, the insurance is no good. And Medicare is going to have a big problem. There's a redistribution of care going on.
Is it worse for specialists? I mean, like if you're elderly, my father is older, has a heart attack, now he's got to go see cardiologists, this and this and this. Does it become harder for him to be able to find a doctor?
You know, Chris, I think it's worse for specialists for the following reason. My dollar is about the same. I get paid about the same for seeing a Medicare patient as I did 10 years ago. Specialists, it's going down and down and down. Okay. So people are not going into the specialties thinking they're going to take care of Medicare patients. They're thinking, I'm going to have to find someone that'll pay me. So it's, in that sense, it's worse. And by the way, malpractice insurance keeps going up and up. So you lose out either way. Right. We don't have the specialists. We don't have the primary care doctors. This is a huge problem for elderly patients. Oh, one more thing, Stuart. 70 million more people, baby boomers like myself, are going to become Medicare eligible.
You got us all scared here, Doctor. Come back and scare us again.
too.
All right, Dr. Mark Siegel, thank you very much.
Thanks.
To the big board.